Hey, Pathlight community, Ruth Banta here. Today is Friday, January 8th. I am going to take off my mask so that you can hear me more clearly through this video. So I've been through 8 days of 2021, and what a start to the year it was. I'm going to be talking about Pathlight issues, but just wanted to say, wow, 2021, you are starting off with a bang. So first of all, I do want to talk about what's happening in our Whole Children Milestones group. They have started classes this week, and they are offering 35 online classes a week. So make sure you check them out through the Pathlight website or wholechildren.org. Lots of really creative stuff happening there. I want to give you our COVID numbers that we have had 2 staff members test positive since last week's video, 2 individuals, 1 in residential and 1 in family-based living, and 1 care provider. We are still very much in the surge, and we are very much have staff who have previously tested positive who are out on quarantine recovering. So I just want to do a special shout out to our residential homes that are doing an incredible job of keeping the programs going, working lots of shifts as this has impacted the staff vacancies that we have already have. So thank you all. If everyone keeps protocols, hopefully we can keep those numbers of positive folks low. But we are in the surge in Massachusetts. So hang in there, folks. Thank you. I've been getting a lot of questions about vaccines. So I want to address with you all what we know and what we are doing. Basically, there are a lot of moving parts around this. And I'm working every day, a couple hours a day, with Pathlight management, healthcare providers, other providers, trade groups, our funders on the vaccine. I was on a call on Tuesday with DDS Commissioner Ryan, and she described the vaccine rollout as bumpy. And we are definitely experiencing that. However, we are making progress. So I want to lay out for you what the next steps are as we're working through vaccine rollout. First of all, we do have a Pathlight team that's working on communication about the vaccine to you, to our care providers, to individuals and guardians and our families. We want to make sure that you have the factual information to make decisions about the vaccine. So that information will be coming out over the next week. We are also working with pharmacies to be able to provide vaccine clinics for the groups that are in priority 1. We hope to start that by the end of this month. And lastly, I said we were talking about working with folks that are in group 1. The state has put out priorities for vaccines, and the Pathlight residential staff and individuals who are in our group homes, which in the state priorities comes under congregate care, are in phase 1, which we are in phase 1 now. We are actively advocating for all of the Pathlight community to be at a high priority for the vaccine. So all the people we're serving through family-based living and family support. So keep posted as we keep working on trying to get everyone access to the vaccine. So basically, things are moving rapidly, changing every day, and we will continue to keep you informed when we have specific information to let you know what's going on. I know this is on many people's minds. In the meantime, we are in the surge. We are still having cases, and the state, the healthcare system is getting stressed if you are following the news. And it's very important for us to continue following the protocols. Wearing a mask. If you have symptoms or you've been exposed to folks outside of Pathlight, please call your supervisor before coming into work. We have different ways of handling this situation depending on where you're working. It's very important that we all work together. Continue to socially distance, to disinfect, and you know my favorite, wash your hands. So hang in there, folks. We are going to get through this together. Thank you. Be well. You're important. Take care of yourselves. And let's hear it for 2021. It's quite a year.